Welcome back, everyone. All right, so we're going to start our second panel now on health communication in public settings, information, education, advocacy, and policy. Obviously, and as I said at the beginning, our division of our speakers into these two clusters was a bit arbitrary. Everybody's work connects the two realms. And so we will continue with that in this second session. So just a quick reminder of our panelists and the order that they're speaking in today. So first we have Stephanie Zoller from the St. Louis Metropolitan Pandemic Task Force and SSM Health, Kara Anthony from Kaiser Health News, Courtney Stewart from the Missouri Foundation for Health, and Ellen Mortella from Northwestern University. So we will start with Stephanie to tell us about her most recent work. What's been keeping you busy the last 6 or 7 months?
This little thing called COVID. As you heard, I work for SSM Health as the communications manager. So I have that internal, external communications from a healthcare perspective side of things as well. And in June, I was tapped to be the public information officer for the St. Louis Metropolitan Pandemic Task Force. That's led by Dr. Alex Garza. For those of you who are not familiar with him, he's our chief community health officer, but he's also got an extensive background. Most notably, he worked for the Department of Homeland Security under President Obama and led the H1N1 pandemic issue. So he's got a big background in working with these types of things. So he's a huge resource and an absolutely amazing man to work alongside on this task force. So today I really wanted to focus a little bit on, I'll start with a little bit of the background of what the task force is for those of you who are not familiar. And then I just want to get into some of the communication barriers and issues really that we've faced and that have come to light throughout this pandemic, and really since June, the last 4 months since I've been taking lead on the communications side of the task force. So for those of you who don't know, the St. Louis Metropolitan Pandemic Task Force is made up of the St. Louis area's 4 major health systems. So Barnes-Jewish Healthcare, you've got St. Luke's, Mercy, and then SSM Health. So at the beginning of the pandemic, it really became clear that we needed to have a unified front on this from a communication standpoint, really, and from a logistics standpoint. So the health systems came together to form this task force where we could not only focus on PPE shortages, the way that perhaps we maybe were becoming overwhelmed with patients, how we would manage shortage of ventilators if that happened, and really how we could work together as a region to ensure that no one health system, no one hospital was feeling overwhelmed, and how we could help each other. It's something that's not being done anywhere else in the country, though I will tell you, we've had many cities reach out to us and ask us how we're doing this and how it's working. It's been exciting and sort of unusual to be partnered with our communications counterparts across the city. As you know, those of you who work in a hospital setting, there's always that competitive side of things, and we're always trying to a little bit outdo the other one. And now we've really come together to formulate a cohesive plan on how we focus on, specifically communications is what I'm focused on. So also part of the task force are government officials. So our local mayor for the city of St. Louis, our St. Louis County executive is part of this, the St. Charles County executive, and so on. So our whole St. Louis metropolitan area, we've got representatives from each county and each region to truly look at this from a regional approach. What are the numbers? How is it affecting our community? What should the message be to our community? And we're really trying to help guide those government officials and those health department officials talk through all of this from a regional approach so that we can try to manage this one day at a time, but one issue at a time. So it's been an interesting ride since June, I will tell you that. I've learned a lot, and we've had a lot of challenges. Specifically lately, we've had a lot of challenges as our numbers begin to rise and the community begins to really feel a second wave kind of emerge, or maybe it's a third wave. The biggest roadblock that we've faced, or we are facing right now, is the communication. We need a new communication strategy. And I meet with my communication counterparts daily, sometimes, weekly, daily, and talk through, like, how are we going to do this? How are we going to reach these audiences in a different way? And really, sometimes it's banging our head against a wall and saying, it's the same message over and over and over again. Wear your mask, stay socially distant, don't gather in large crowds. It's quite frankly becoming white noise. So how do we change the message? How do we make people pay attention? How do we work with our partners in the media to tell the story and to put a face to COVID? And we know the community is tired. We know the community is exhausted. They don't want to stay socially distant anymore. They want to be together. We want our kids in school. We want to play sports and all of these things, but we have to do it safely. And how do we, quote unquote, make people do that? We can't make them do that, but how can we better educate them to know that this isn't over and the work needs to continue? So really, that's been our biggest struggle as of lately. We just had a big meeting this week to try to turn the communication message on its side and say, how can we look at this a different way? So that's really what I'm kind of dug into right now from a communication standpoint, is trying to tell our story in new and exciting ways. So that's one of the big roadblocks that we're facing. Another big roadblock really for us is social media. While it can be really useful, it can also harm us. Getting our message out there and just getting the message out there about science in general can be difficult when there's so many other voices out there, and people can choose who they listen to and who they deem an expert. So how do we push our message to the forefront? How do we market our experts as the experts to listen to and make them believable and make sure that people understand that this is a serious issue and that these are our experts and this is who we should be listening to. One other thing that we talked about much earlier at the very beginning is politics and the role that politics is playing in all of this. It's not just about science anymore. It's about policy. It's about how this affects the community from a political standpoint, and it's very heated, and sometimes we get caught in the crosshairs. So, how can we change that message and become that neutral ground where we're believable and don't become swayed by one side or the other, or viewed that we're swayed by one side or the other, to really keep that trust with the community. So that's been another challenge for us. So ultimately, I want to wrap this up by saying, and we've talked about this a little bit in the last session, about building relationships with reporters and telling the stories and getting those stories out there to the community. And that's really ultimately what my job is as part of the task force, is to not only relay information to the public. We hold weekly press briefings, bi-weekly press briefings. We send out information daily to the media, and it's formulating the relationship with those reporters and with the media in general to ensure that we're getting the message out there that we need to tell. So my job is to work with those reporters to make sure that they have everything they need to tell the story that they need to tell. And I need to provide the information that they need, whether it's talking with Dr. Garza, whether it's talking with, this week, we talked with nurses on the front line about how they're feeling and what they need us to do as a community to support them, whether it's talking with a sports medicine physician about how to do sports safely. These are the things that the journalists are depending on me as the public information officer to help them find the right people to tell the stories. And I'm relying on them to be my messenger, quite frankly. We need each other. And that really what ultimately it boils down to is that they need to trust me, that I'm going to give them everything they need to tell the right story. And then I need to trust them that they're going to take that information and relay it to the public so that we can get our message out there, the message that we need to send from a science-based background, and try to cut through all of the noise that's out there these days. So we've learned a lot over the last couple of months. I've been really impressed with my entire team from a hospital perspective. They've just really persevered and stepped up, and it's been an honor to watch them and go through everything that they've gone through and the things that we've had to manage. And then just the task force in general, it's been incredible to be part of a team that's working so hard on behalf of the community and on behalf of public health, and really on behalf of just telling the truth and making sure that people understand just how serious the situation is. So that's all I have.
Thank you, Stephanie. It's
Mhm.
very good. You're in the role of both an information provider and a persuader, but in a situation where the persuasion is in the interest of the audience. And so much of our life, we learn it becomes a habit to resist persuasion because it's in the interest of the retailer, right, or the advertiser. We develop defensive habits to persuasion, but the health communicator is trying to persuade us for our own good, and it's a unique communication role.
It's been unique and challenging, and just a huge learning experience as well. So it's been it has its own set of rewards and challenges.
Yeah. So our next speaker is occupies another role in this communication chain. Kara Anthony's with Kaiser Health News, and Kaiser Health News, very interesting organization that tries to promote public understanding of health and medicine and science in all circumstances. And of course, like so many of us, suddenly we're in a pandemic and everything is immensely more pressured and immensely more important. Kara.
Thanks, Dean. I'm glad to be with you all today. I want to do a bit of a show and tell, so I'll share my screen here shortly, but just to give a little bit of more background about me. I'm a native of East St. Louis, Illinois, and grew up in the area, but spent the first 6 years of my career working all across the country. I worked for all of the big media companies. I worked for Gannett, USA Today Network, McClatchy, Tribune Company. So I have a really good idea of how corporate media works. This is actually my first time entering the nonprofit sector, but boy, has it been a great experience. And I find now working for Kaiser and, obviously supported by the Missouri Foundation for Health, that we have an opportunity to tell really rich stories. I take my time now with the stories. I really dig in deep. And I loved what all of the earlier comments today that just talked about reaching real people. That's what we do. That's my strong point. I love people like Stephanie who are like, okay, who are the real people who I can identify, and and then tell the reporter, tell the journalist about those folks so that we can make it real for people. Kaiser Health News is a health policy organization. We're a news organization, but we tell health policy stories really well. I came in with not a lot of background in that area, but one thing I do love, I really love people, and Kaiser welcomed me with not a lot of health experience, but a lot of people experience. And so now we've been able to really go out and tell some of those stories. And so in this pandemic, though, I found that now people are saying we're in a twin pandemic because they're nervous about what's going to happen with the flu season in addition to COVID-19. But really, I recognized pretty early on that we were in a twin pandemic because of what was going on with COVID-19, but also police brutality in this country. And so with those two things happening, especially when you're thinking about communicating to African Americans, Black Americans, we really have to think about that a lot of Black Americans are extremely traumatized already, in addition to what they're seeing on television and what they're reading and all the headlines and what they're seeing on Facebook and shared amongst their friends, in addition to, COVID-19. And so it's like really communicating to my community is so important, but there's a really strategic way to do that. And I've been trying to be very gentle in my approach and very sensitive in my approach because I have covered both. I just came back from the Boot Hill of Missouri, where I'm working on a project about racism in rural America. And while we were talking about COVID-19, but we're also talking about lynching. And so that's something that will come out probably in 2021. But there's a lot on health reporters, and then me also being a African-American health reporter who's a woman. Boy, do I get all kinds of pictures and calls, and the weight on me is extremely heavy, but I think that we're finding a good balance. So I'm going to share my screen so you can kind of see what I'm talking about in this show and tell format here. So I think the first thing I want to just pinpoint is that there was a call that I received from the National Press Club, who kind of noticed, again, how I was covering before the flu season, started, and people were talking about that, how I was thinking about this as a twin pandemic, thinking about, race and identity, thinking about COVID-19 and George Floyd. And they just asked me a number of questions, and I can share this link with the group at some point about my approach. And one story that caught the attention of Time magazine, it was right after George Floyd had been killed. And I decided, we need to recognize again the other pandemic that's going on in our nation. And we decided to do a Q&A. Well, this was a Q&A with me, but I wrote a more traditional story about a mental health, he's a counselor who works in St. Louis. And basically I had met him a few months before because I had done a story about where children hide when they hear gunfire in the city of St. Louis. So children going into bathtubs, children going into closets, going under beds. And in this story, I thought he would fit into that, but he was so interesting in the way that he was counseling the kids in St. Louis that I said, you know what, I remembered him telling me about these unwritten rules. And as a young Black American myself, my father has, shared different things with me about how I should conduct myself and how I have to move differently, maybe than my white counterparts in this world. But it seemed like the right time to bring this particular counselor back. He's a pastor. His name is Darnell Hill. He works for one of the largest mental health agencies for kids in St. Louis. But it was just wonderful just to talk to him. You can kind of see his face there. I did the photography on this. And so that particular health agency, did they pitch this story to me? Absolutely not. But did they welcome me into their space and say, yes, you can talk to our counselor. He's not off limits. Yeah, they went as far as connecting me and even opened it up to say if I wanted to talk to families. Obviously there are things that signatures that have to be signed and clearances that have to be approved, but we ended up interviewing, I don't know if Time shared his photograph, but it was someone who had been released from the program and had a success story. And so they went back and connected me with that person. I'm not seeing, I think we published it, but anyway, long story short, this story went everywhere. It was on Apple News for that particular health agency. It really worked out. Was that something that they pitched to me? Absolutely not. But did it help them, share a little bit about their mission and message? Yes. I mean, Time Magazine is a huge organization and still very well respected. And I want to pivot a little bit and go into something that's a little bit more traditional. There are lots of coalitions that have been formed and lots of health advocacy groups who are very focused on COVID-19. And I sit in on a lot of meetings with people just like you, and I try to listen for nuggets, listen for those real people. And sometimes when I don't hear something though, I might make a call and just say, what am I missing here? I hear that you're doing this and this and this, but who are you delivering the food to? Where are you going when you're distributing all of these services? And so in this case, I made a call to a coalition member at East St. Louis. They have a wonderful initiative on the other side of the river, and they're doing some really great things. I believe they've had $1 million grant even go to a nonprofit there very recently. But in making just a private, separate call after a big meeting like this, I learned the story of two twins in East St. Louis who were helping each other through the pandemic. And this is Edna and her sister Ethel. And this story actually was picked up by KMOX radio and ended up being distributed widely through their entire system, which was wonderful. We have a wonderful partnership model at Kaiser. So oftentimes when I write something, it does go to other media outlets. For example, I gave the Time Magazine example, but I've also had stories in the New York Times. And I just finished another story about intersectionality and Black hair and what that also means in the pandemic. I really try to think outside of the box and really meet people where they are. But again, in this case, I had to do the photography myself because I think it was mentioned, boy, there are some journalists. We don't have as many health journalists as we used to. And also, we're all trying to do a little bit of everything. I'm getting ready to launch a podcast, but I'm also hopefully getting ready to launch Kaiser's first film, a documentary film that we're really excited about. I can't get too many details yet, but we're really doing it all. And one of my colleagues said, now, wait a minute, Kara, you write the stories, you just did an essay, you're talking about a podcast and you're gonna do a film? Well, absolutely. In 2016, I had an Emmy nomination come through when I worked for the Belleville News Democrat. But, I want to tell stories and I want to meet people where they are in many different ways. Not everybody reads the news. Some people prefer to watch it. Some people prefer to listen. Now, this is a very important project for Kaiser. It's groundbreaking. We teamed up with The Guardian and we've interviewed, hundreds, I think it's 244 interviews that have been completed of family members. We've interviewed their family. We're writing obituaries of healthcare workers who have been lost. And if you don't know about this project, it's called Lost on the Front Lines, and it's really stunning work. We've broken it down. You can see all across the country where healthcare workers have been lost. We've broken it down by demographic, their jobs. I worked on this project in the very beginning, and when I tell you this work is difficult and it's hard, and I know we talk a lot about clearances and how to get permission from these hospitals to say that, confirm that they work there. A lot of these deaths are still under investigations, but my main focus was really calling those families. I spent time with wives of, past healthcare workers who have died. I've spent time with, their children and talking to them on the phone, really trying to make a human connection. And, it's difficult in the time of coronavirus, but it can, be done. I mean, I can't emphasize this enough. I have such a big passion for real people. That is why I went down to the boot heel in the middle of a pandemic, because I just thought it was just so important to cover that. We talk a lot about what happens in our large metropolitan areas, but rural communities, I can't stress that enough. They need to be a part of the larger narrative. But just finally, this is a family that I met many years ago and known them for a long time, but I'm in a multi-generational family. I'm a single mom and I live with my parents. My daughter and my parents are actually upstairs right above me right now, hanging out. And I thought, well, again, it's just kind of leaning into who you are. Journalists do that sometimes. And I decided, well, let's write a story about multi-generational homes and some of the things and how they get through this. And, ended up talking to a great organization in DC called Generations United. And again, that became an opportunity for them to share, their tips and strategies. There's a tip sheet in here connected, but it was about really finding those real people. And then the advocacy group supported me. So I hope you all enjoyed that little bit of a presentation and see where I've been and how I think. And glad to be here. I'm happy to answer any questions.
Kara, that's great. And I'll tell you, I read that multi-generational piece in the New York Times. I love the way your comments illustrated the fundamental enduring foundations of journalism, which are talking to people, making notes and writing stories, and the multimedia necessity of journalism today, that you're using every possible channel to reach your audience and you're pushing the story out through every medium. It's That's how it works these days. So next we get to hear from Courtney Stewart of the Missouri Foundation for Health, who works in the realm of public advocacy and health advocacy. Courtney?
Hi, everybody. Thanks for having me. I'm an alum, got my master's from the School of Communications, I think back in 2005. And since then, I have experienced a wealth of knowledge and learned so much more about communications, but that was such a great experience. I have to plug the fact that I did study abroad in my master's program while I was in the School of Communications. So I took advantage of all the offerings at Webster University. And I am I'm from Webster. My family is from Webster. And so I have really rich ties and history to the community. I love it so much. So thanks for having me, Eric and team. As Eric mentioned, I am the Vice President of Strategic Communications at Missouri Foundation for Health. I am familiar with most of all of your work on the panel in one way or another. Stephanie, we had touch points because your work with the pandemic task force is on the hospital side, but our work with the regional response team during the pandemic that is led by Dr. Jason Purnell, that's on the social services side. It's doing all that coordination on the other side of things. But I work for Missouri Foundation for Health. And for those of you that who might not be familiar with the organization, we are a regional change maker, sometimes labeled a funder, but that is just a small piece of who we are and what we do. We do so much more. We have a number of change-making tools that help us do our work under the mission of, we actually just changed our mission. We were once improving community health. Now we're eliminating underlying causes of health inequities, transforming systems, and enabling individuals and communities to thrive. And that was important for us to transition to those specific words under our mission just a few weeks ago, because we're carving out our lane in systems change. We operate under a few values. Just to give you some background, those core values are equity, integrity, humility, and commitment. And those are important to all aspects of our work, but especially important to communications and how we show up, what we say and how we say it. We do tap into those values when we're deciding that. We actually support communities in 84 counties in Missouri, including the city of St. Louis. Where we don't support is that northern area of Kansas, and that is because of the history of Blue Cross Blue Shield, as I mentioned before. We have a number of issues that we work on. Most notably, probably to this point, is our work in Medicaid expansion. That was a big win for our state and for our portfolio. We invested millions into that effort and getting that win. We are very proud that that's going to be happening in Missouri. Also, we do work in childhood obesity, infant mortality reduction, all centered on equity. And so, of course, when we started experiencing the pandemic a few months ago, it was only natural that we jumped in and tapped into what we consider our immediate response. Our work is on various time horizons, and it's very strategic. So in the short term, we did invest $15 million into efforts like the Affinia Health Testing Centers, CARE STL, where others were going to be tested. We are also behind Prepare STL, that communications and outreach effort that's going on in some of the most marginalized communities in the city of St. Louis and some zip codes in the county. And for those zip codes that are not covered by Prepare STL during the pandemic, we have a communications initiative called One for All Missouri, which is a partnership with the Missouri Center for Public Excellence and the community health centers and public health agencies in the state, and helping them to elevate their messaging. So communications at Missouri Foundation for Health, I have to say, is a really important change-making tool for us. We figure we cannot do our work and have the greatest impact unless we are thinking about communications as a strong, effective strategy on the front end. It's not one-off for us. It's not picked as we go along the way. It's thought about on the front end. Where do we want to be? Do we want to empower community, have this to be community-led? Is this something that the foundation wants to jump out and lead? Is this aligned with our public affairs agenda? How are we going to approach this? And so just like we use health policy and we use advocacy and we use learning and research and data and assessments to inform our work, we use communication strongly in that way. So that kind of transitions me to strategies, like real life strategies in that space. The Kaiser Midwest Bureau that's one of the strategies. So the work that Kara is doing and she's talking about, that was born from an idea around actually my CEO, Bob Hughes, having a vision and recognizing that we needed to strengthen health journalism in our area. We have so many local gyms and institutions. Of course, we're home to the St. Louis American, the #1 Black newspaper in the country, but we still have some weak infrastructures. We have the University of Missouri School of Journalism that has that association and producing some great journalists. We have the efforts that Webster University are doing, but the stories weren't being told. Our stories weren't making it onto the national stage. And they weren't being shared in a way that was real, that resonated with folks. And so we started thinking about how we can introduce that idea to our communities, to our region. Kaiser was very early on doing some of that work. Not as broad now. Now they're doing it in Colorado. Since we've made that partnership connection with them, they're doing it in Colorado. And I think Milwaukee has added their own bureaus too. But we wanted a way to have reporters, our own reporters, and to elevate our philanthropic support of the field. It's very important. It's not the same anymore. And that's what Kaiser was helping us to do. So in addition to those types of communication strategies, we do a number of campaigns. Some of you may have been watching Hulu and seeing those Medicaid expansion commercials that featured local talent. Missouri Foundation for Health, we were behind those commercials. Any of the census work, if you've seen a blue and white sign, yard sign, and or you've heard anything on St. Louis Public Radio, or you've seen any of the interviews taking place with a number of our partners, including the City of St. Louis and a number of nonprofit agencies in the area, we were behind that work. So we've kind of just transitioned into COVID because it's what's in front of us right now. As I mentioned, 15 million was our short-term response. We are moving into our long-term response and thinking about now how we can transform systems. So when you think about the three things that came about for us and are probably going to stay with us because of this time of COVID, I have to say that the pandemic has really elevated the need for supportive messaging in the public health infrastructure space. We don't think of that system as a real thing, and it is. And we need to start taking it seriously as we do the healthcare system. It's not the only system that we have. It's where things like fresh running water comes from. And we need to think about the importance of that system, not just when there's something wrong. And it's not just a health thing for us to elevate, it's a cross-sector thing. So how do we coordinate our efforts and present messaging and communication that can tie us all together and really showcase the importance of public health? And how does that also strengthen our public health infrastructure otherwise, just for other things? So that's one area that the foundation is working on, and the communications is being woven into that through and through. Another area that I'd have to say that's become apparent for us that's rooted in communications is actual and factual information and getting away from misinformation. We've heard it on this meeting, this webinar, so many times already, meeting people where they are. People are experiencing the pandemic. I think it was you, Bob, that said people are experiencing the pandemic in so many different ways. The way I'm experiencing it in my second district city affluent home is not the way that other neighbors and other communities are experiencing it. And we have to talk to people in their language and elevate platforms and messaging and content that resonates with them. If we don't, I think, Stephanie, you said white noise, it is going to become white noise. So we got to stay on top of being creative and innovative with that. The third thing that I would say is gravitating more toward research informed. I don't think that communications can be the most effective if you're not doing research. We're really lucky at MFH to have our own department. Our learning and research is led by Dr. Catherine Fritz. But any communications work that we do, anything that we're doing on Medicaid, anything that we're doing on safety net, and now we're venturing into vaccination research to inform any communications. We don't want it to be anecdotal. I can give you a million stories on why I think my people, being Black folks, might not want to lean into and support this vaccine. But that's based off of stories that my parents told me, stories of Tuskegee Airmen and the historical context behind syphilis and how we've been treated in the system. So what's real time right now? Are the historical factors even a point of concern for folks that'll be that are now exposed to COVID and are going to be pushed, messaging is going to be pushed to them about this vaccine. So we want to know. So we test and we poll real Missourians, your neighbors, your colleagues, to see what are Missourians thinking. And then to your point, Diana, about messengers and nurses and who folks value as being message deliverers, we test that as well. So do folks really want to hear from the pharmacist? Are the messages that we're putting out there for politicians to share, are they hitting? Or are those considered trusted messengers or not? Are nurses trusted messengers? And if they are trusted messengers, in what context should we use them? And who should they be trusted messengers for? So it's having the most effective communications practices and being the most strategic in this time of ever-changing, crazy misinformation, complexity, all those things. And that's what we're doing. Yeah, so I'll stop there.
Thank you, Courtney. That's great. And what a powerful example of where a mission statement really means something. I mean, that shift from promoting health to eliminating the underlying causes allowed the whole organization not only to expand your purview, but to be proactive rather than reactive. A great, great example, because we all love sitting in meetings debating mission statements. But sometimes it matters. Sometimes it matters. Your emphasis on research is a perfect bridge to our next speaker. Ellen Mortella has done some work from Northwestern University. She's done some very impressive work on children's advertising, amongst many other topics. And I'm not exactly sure which example she's going to share today, but I know of her work on advertising for food on children's television and its connections with food labeling and with obesity. So Ellen?
Thank you. I feel a little bit like a fish out of water because where we're sitting and where we're living right now, concerns about the coronavirus sort of sucks all the oxygen out of the room when you want to talk about health issues. And I'm not going to talk about the coronavirus. I have three messages, 3 points that I want to make, and then I'm going to illustrate them with a case study of the childhood obesity crisis. To begin with, though, I should tell you who I am and what I do. I'm a communication researcher with a background in developmental psychology as well as communication. And as a young graduate student, I unfortunately had the audacity to actually testify in front of the Federal Trade Commission and the Federal Communications Commission when there was consideration in the late 70s about regulating advertising to children too young to understand the purpose of advertising. And that essentially launched my career. So what I say I do now is I do research at the nexus of public policy questions, developmental psychology, and communication studies. And the 3 points I want to make is, how do I find my research questions? Because I'm an academic. I'm an academic who's testified several times in front of Congress. I have been in the National Academy of Sciences. I was on the 2006 Obesity Committee report. I was chaired the Front of PAC Committee in 2011. I was on their APOP Committee, Advancing Progress on Obesity Prevention, in 2014. And through those activities, I have continued. I've been on the board in Children, Youth, and Families. I've done a number of things in Washington in terms of testifying, but as well, I've done some nonprofit work, and I'll talk a little bit about that at the end. Because of my research on children and technology and media, I've joined a number of groups, and the one I'm probably going to talk about the most is something called the Public Goods Project, which came out of the obesity study of APOP and is a nonprofit organization committed to public health campaigns around the world. And through that, I've become involved with and interested in doing research on the anti-vax movement and vaccination. But let me go back and say my 3 points. Number 1, it's important for academics and researchers to choose their questions well. And I'll be quite honest, I get most of the research questions that I want to study because I want to provide data and evidence that would be useful for policymakers. I usually get my research questions from the New York Times, and what is being asserted regarding technology in children and what's being asserted about the issues of the day. So last year I was doing a variety of studies around the country, East Coast, West Coast, on social media use and mental health issues among adolescents. That project has come a little bit to a halt. I'm hoping to launch a national population survey on that. I've been doing focus groups, but that's going to have to wait until COVID's taken care of. And more recently, I've become involved in the anti-vax movement through a group called the Public Goods Project, which has a relationship with the UN and is looking at the anti-vaccination movement literally around the world. And I've begun a study looking at how anti-vaxxers are portrayed. Most of them find each other on social media. And what do we know, particularly what I want to launch is, what do we know about adolescents? Because after the aged and people 21 to 44, adolescents are going to be very important once we do get a vaccination. And what we know from previous public health campaigns and public information campaigns, such as seatbelt use, that adolescents and children can enforce and encourage their parents to engage in this public health campaign. So I want to know what adolescents know about vaccination, what their concerns are, so that the data would be useful once a vaccine comes around in forming a public health information campaign on how to reach adolescents. Okay, so the 3 points: choose your research questions well. And I was lucky, I chose very early on research about children and television advertising. And then secondly, I want to give you an example through the obesity crisis of how research can be extremely useful in both the development of policy and the development of practice, because I'm interested in producing and examining television shows and social media programs for kids. I was a trustee of the Sesame Workshop for many years, and now I'm a member of the advisory board of the Joan Gans Cooney Center, which is the research arm of Sesame Workshop, the makers of Sesame Street. And third, I'm going to make the point that when we try to influence, particularly a topic that involves industry as well as academics or regulators, industry and regulators, and that's where the obesity crisis comes in, because food marketers were very much implicated in the childhood obesity crisis, that there's a dance that goes on, that without government regulation or the pressure and promise of government regulation, my observation is you're not going to see the industry engage in self-regulation. So let me illustrate those 3 points with a really quick overview of what happened in the obesity crisis. Before the obesity crisis really came to the forefront in the US, which was about 2005, 2006, which was the first National Academy of Medicine, now it used to be called the Institute of Medicine's report on obesity. There had been established in the mid-1970s something called the Children's Advertising Review Unit of the Council of Better Business Bureaus, which was a self-regulatory arm of the industry to respond to what was growing pressure in the late 70s to take advertising off the air to children too young to understand advertising's intent. And this self-regulation was an intent to try to protect the industry from regulation by saying we're going to regulate ourselves and set standards for how to advertise to kids. By the 2000s, that general concern about advertising really became a concern about obesity. And the Institute of Medicine took up in 2006 its first reports on food marketing and the diets of children and youth. And lo and behold, what did they find? Through that report of 2006, well, they examined the marketing landscape for foods marketed to kids, and they examined the evidence of the impact of food marketing on children's diets. That report found that the food and beverages that were marketed to children, by and large, were high in sugars, fat, sodium, and calories, and marketed foods and beverages were low in fruits, vegetables, whole grains, and dairy products. In short, it was not a diet you wanted your children to have, what they were seeing on Saturday morning and elsewhere. They also found, and I was part of that study committee in the review that we did, we found strong evidence across research studies going back 20 years that the effects of food and beverage preferences, that the effects on food and beverage preferences, purchase requests, and short-term food and beverage consumption of 2 and 11-year-olds was strongly influenced by the TV advertising they were exposed to. So let me say that again. We found evidence that TV advertising did indeed have an impact on 2 to 11-year-olds' food and beverage preferences, their purchase requests from their parents, and actually what they were eating and consuming. We found moderate evidence of effects on food and beverage beliefs of the younger children, the 2 and 5-year-olds, and we found a relationship among adolescents of how TV was influencing their food and beverage choices. Well, that report, 2006 report, came out, and there were many discussions in Washington. There were a lot of conferences held, and the industry responded in 2007 by establishing the Consumer Food and Beverage Advertising Initiative, which was a special initiative within the Council of Better Business Bureaus to try to address these concerns about the food and beverage industry and how they were marketing foods to kids. Well, that was 2007. And the Institute of Medicine continued to look at the obesity crisis. In 2011, they had a report on food, on front of pack food marketing. What kinds of information should you provide in the front of pack of foods, packaging foods, to let consumers know if they were high in fat, sugar, salt, what the average number of calories are per serving. I happen to have chaired that committee for the Institute of Medicine, and our report came out in 2011. And it was quite clear that when that report came out, CFBAI, which was criticized somewhat in the report for not adopting more self-regulatory food and beverage labeling, they responded by considering the labeling issues again. And so there were a whole bunch of conferences looking at labeling. And at that time, the Food and Drug Administration was actually considering requiring labels, a certain kind of label on the front of all packages. Although in the United States, we do have labels on packages, and those are all self-regulatory. Those are all created by the industry themselves and what they want. When the Food and Beverage Advertising Food Labeling Report came out in the years between 2011 and then the last really major report on childhood obesity, which was called the APOP report, which came out in 2014 from the Institute of Medicine. That report reviewed all this literature, and I was on that committee as well. That report essentially chastised the food and beverage industry for adopting self-regulatory standards through CFBAI that varied from industry and industry. So that if I was making packaged cereals, I might have really good standards for what was in my product in terms of well, let me see. Well, I would have bad standards on sugar if I was in the cereal industry, but I might have great standards on sugar if I was in the packaged fruits and vegetables industry. So what the industry was doing was carving their self-regulatory guidelines for nutritional standards that would benefit them so that they didn't have to change their product formulation. Well, all of that came to a kind of screeching halt by 2014 and 15 when the APOP report came out, because it got a lot of it really criticized the industry for pretending to be engaged in self-regulation, but not doing an adequate job. And again, the Food and Drug Administration threatened to actually set standards for food labeling and set standards for what needed to be regulated within the food and beverage advertising industry. So that after a 2-year comprehensive review of its criteria following the publication of its 2015-2020 dietary guidelines for America, the FDA announced that it was going to revise food labeling regulations and that it was going to ask for uniform standards that all food products had to meet. And that these standards would be nutritional standards set by nutritionists in terms of what they thought should be appropriate standards of the amount of salt, fat, sugar, and the kinds of vitamins and minerals, et cetera, that needed to be in products. What essentially happened between 2014 and 2000 and today is that the industry adopted these uniform standards because they did not want to be regulated by the Food and Drug Administration, and that we now have uniform standards in food products. And there was a whole host of reformulation of food products between 2014 and today. A number of companies went back and reformulated their food so that they were healthier, and they began to promote those. And what they found by about 2017-18 was that the American parents and the American public had become much more aware of nutritional issues and obesity issues, and that they were seeking out healthier foods for their children. Around this time, between 2013-14, because I had been involved, and I was one of the few communication researchers involved in a lot of these discussions, I got invited to be on a number of advisory boards. The most notable one was the Consumer Goods Project. And the Consumer Goods Forum is a consortium of food manufacturing companies around the world, and what goes into grocery stores. And it's a self-regulatory body, and they established a health and wellness council to be part of their advice to their members. And I was part of that council. So what's happened since all of this was happening between 2013 and about 2017? Well, a number of things happened. We had a change of administrations. The childhood obesity crisis seemed to be addressed with. You saw fewer articles in the press about it. And the threat of government regulation subsided. The FDA stopped its investigation of setting standards for front of pack food labeling because they said, well, the industry's taking care of it. And the last study commission at now the National Academy of Medicine was in 2013 when they actually had an obesity council, which they subsequently got rid of about 2016. And the end of the story is that by today, all of these committees that I've been on have been disbanded. The Food and Beverage, the CFBAI got rid of its advisory council. The Institute of Medicine got rid of its obesity committee. The Food and Drug Administration has stopped commenting that it's going to do anything about food and beverage advertising or front of pack information. And as a consequence of that, I apologize for that. As a consequence of that, a lot of these advisory groups and self-regulatory groups have also disbanded, which makes my final point, that my observation has been in the world of regulation, at least around food, but I think in other areas as well. The threat of regulation leads to self-regulation in industries. The lack of that threat lets the industries fall back and become less interested in trying to engage in some kind of regulatory activity. So my example then of what's going on now for the childhood obesity issue is it's really died down as a concern. You don't see much about it because, as I said, all of the oxygen in the air is being taken up by the coronavirus. So let me talk a little bit about what I hope to do in the era of the coronavirus. Choose my questions well. I think we need to know about adolescents. Since I study kids and adolescents, I think we really need to know about how adolescents view vaccination and what their concerns are about the arrival, we hope, of a vaccine about that. And that's the kind of research that I'd like to do now. Secondly, I'm trying to explore what's being said about vaccinations and adolescents, so that the kind of data that I might be able to collect, which I hope will be national population data, could be useful to those who are trying to promote vaccinations, and also could be useful to get kids, to get their parents to take the vaccinations. I'm sure you're all aware that the numbers keep going down about the number of Americans who say that they're interested in having a vaccination if it comes along. It's not just in this country. The work that I'm doing with the Public Goods Project, we're around the world, we're looking at these issues, and it's everywhere. There's a lot of concern about vaccinations. And so that's the question of the day for me. And I got those questions, of course, from the New York Times. And my hope is that I'm just a communication researcher, that the kind of data that I collect will be of use in the kind of crisis that we have right now around communication. And I'll stop right there.
Thank you, Ellen. I'm glad that the sad ending of that story hasn't dampened your optimism and your determination.
No, life goes on.
Yeah.
The issue, childhood obesity will come back as an issue once there's room for issues other than the coronavirus.
All right, thank you. So now we're lucky to have as a respondent Dan Mueller from our business department here at Webster University, and an experienced health institution hospital administrator. Dan?
Thank you very much, Eric. I want to thank all of our panelists. You certainly have taken a subject matter and broadened it out in a number of different areas. But I think there's one thread that runs through all of this. And I think the thread is, how do we strongly encourage people to change behaviors? And I can tell you from my past experience as a father of four children now that are adults, as adolescents, I didn't do a very good job. I didn't do a very good job in changing their behavior during adolescent years, but it was surprising when they became 21, they found how mature I was in some of my judgments and some of my feelings. Courtney, I think your work in the Missouri Foundation for Health is excellent. I had an opportunity years ago when I was in a past life to be responsible for the CHART project here in the state of Missouri, the Community Health Assessment Resource Team. And what we were trying to do there was try to bring communities together to focus on subject matter or illnesses or injuries that were not really competitive with that environment, but were really enhancing the quality of care and the quality of programming in those communities. And one of the things, Stephanie, that we reached out to was not only the government officials, but also the religious and church leaders. We found them to be real strong advocates for our message. And our message was decreased alcoholism, child abuse, elder abuse, teenage pregnancies, some of those issues which they're not competitive in our traditional competitive environment of hospitals or healthcare systems. So the overall message I think I received from everyone, and it was a tremendous message, by the way, is how do we, in our role as a journalist, as an advocate, as a community health worker, and as a researcher, how can we develop the documentation and the information to make sure people's awareness helps lead to some kind of behavior which is of value for them and of value for the community. One of the things that I did years ago, I had an opportunity to spend some time in my life working on a dissertation. And I wrote my dissertation in communications and marketing. And one of the things we were trying to find out is, how do people cognitively process information from our mind down to our body to make some movements or actions or change in our behaviors? And what we found out was that how the message has been delivered is real important. Not only the person delivering the message, but the target audience that we deliver it to. If you're going to talk to me as an adult old man, which I am, you can see by the color of my hair, but it's still staying in my head. You need to talk to me in that way, not as a teenager. I work at a gymnasium and they keep playing the music of rock and not rock, but I don't know what kind of music it is. And I look around my audience because I go early in the morning and 80% of us are gray-haired people. I don't even understand the wording there. And it really frustrates me. If they would put a better song on, and I'm not talking about music, but I'm talking about giving me a message that I can understand. If you want me to change my behavior, you want me to build trust in what you're saying, then give it to me in a message that I understand. So if we're talking about making sure that kids don't, especially teenagers, won't be anti-vaccinations or vaccine, maybe we ought to go into the junior highs. if we're going to talk about parents in communities taking care of elderly care, maybe we ought to figure out ways to talk to those individuals in our nursing homes or our long-term care centers. So the message here is, let's deliver the message for the consumer that we're trying to change the behavior in. And I think all of you are trying to do that in a number of different ways. It really is exciting for me to be living in St. Louis, to see some of these collaborative efforts going on. But I got to be honest with you, I heard that same thing years ago when I was working with the CHART project. Or we're going to work together and we're going to get things changed. And I'm here to tell you today, I'm sure things have changed, but the rapidity, I mean, the rapidness of that change is really limited. And I think what we're talking about now is something very, very dynamic, and that's this COVID-19 virus. We don't know as a group, and I'm talking everyone, where's this thing going to go? Is it going to get bigger? Is it going to get littler? And what's coming next? What's going to happen next? What's good for me, though, in healthcare administration, it seems as if my colleagues that are providing the direct patient care on a day-to-day basis in hospitals and other healthcare settings, they understand the importance of preparation and preparedness and training of staff, and making sure that when we have shortages in staff, we can figure out a way to maintain our staff and give them the protection that they need so that they can actively participate with our patients, and then making sure that there's public safety with our patients. So I think the overall communications that I received this afternoon from all of our presenters, and I really do thank you for that, because you really enlightened me and opened my mind up to new and different ideas of how we can really deal with these issues, is this idea of developing the message to the audience that can understand it, appreciate it, and then comply and take action in a more positive way. My comments.
That's great. Thank you, Dan. So I see some questions coming in from the audience. I encourage everyone to continue using the Q&A. Just type your questions in there. And before we turn to that, though, I want to give the panelists themselves a chance to add any comments or echo any comments of each other or ask questions of each other.
So I'd love to ask a question of Ellen and then another question of the whole group. The first for Ellen. So you made the comment about adolescents influencing their parents, and I agree with that. However, I wonder if, as you look at the issue of their attitudes towards vaccinations, whether you would, or let's say it's the protections during COVID, whether you would also look at parents' political affiliation and whether that makes a difference in the child's beliefs and behaviors.
When I do this research, I collect a lot of demographic information. So of course, that'll be part of it. The reason I'm particularly interested in adolescents is because a lot of the anti-vax movement in this country started in social media primarily, which is the media of choice of adolescents. And so I'm curious about what kind of information they're getting about the anti-vax movement in the United States. And yes, my intention is to look at the whole issue of how adolescents view this of interest. I think about 6 years ago, I actually did a national population survey on teens and health. And even then, this is like 6 years ago, we found that teens got most of their information about health. They didn't want to ask their doctors. They didn't want to find it out from their parents. They were getting it online. They were going to the internet and asking their friends. And at the time, a lot of what they were looking at is information about sex, but even information about health. They did not want to talk to adults about it. They wanted to go to sources that would provide information from other kids. And I'm finding out now that social media today's teenagers are not developing the habit of reading newspapers. They are not developing the habit of watching TV, qua TV. They're into streaming services and they're into social media, and they're getting their information in different places. And if we're going to try to reach them, we have to realize where they're getting their information and what kind of information they're getting, and reach them where they are. So I'm learning more about this because I'm teaching a course right now in adolescent development with undergraduate students, and my students are teaching me as much as I'm teaching them, if you want to know the truth. I'm using them as the focus group about what's going on. And it is really a different world. They don't trust a lot of what we call mass media and the traditional media. They're just not interested in it.
No.
Absolutely not interested in it. So we have to find a way of reaching them.
Great, thank you. And then my other question for everybody is, I think it was Stephanie who brought up the issue of how to communicate. A couple people have brought up how to communicate about the mask wearing, about social distancing, et cetera, in a new way. And so in this rural upstate community of mine, we've been grappling with this. And we just launched an initiative that may fail, that is trying to merge the interest in open the economy. We have to open businesses, and we're doing pretty good in this county, actually. But we want to keep doing well. And so we wanted to combine the message that if you care about business, if you care about our community, that you'll do these things. So we've got a poster campaign that we're also talking about on radio. I have a radio program up here, and as well as using some other media. And they commissioned 4 local artists to do art around masks, and they're very different approaches. And so we have 4 or 5 different pieces of artwork, but on the poster, the messages are the same. It's called The Heart of Nursing with Art Emphasized. And then it says something like, healthy people, healthy businesses, healthy communities, together we thrive. Now, I don't know if the message is going to get across, but it was getting away from saying just wear your mask. It's saying if you want healthy businesses, which we do care about here, wear the mask, do the social distancing. So I have no idea if it'll have an impact, but I'd welcome any thoughts on, is that the kind of reframing, or do we need to even blow it up even more?
Unfortunately, I think we're going to have to blow it up even more. We've been down that path of pleading for people to understand what this is doing to our community, and unfortunately, people still aren't listening, or maybe they're just tired of that message in general. The one thing that we really haven't tried here, and we're getting ready to do that, we've started to do a little bit of dabbling in it this week, is putting a face to it, putting a face to the pandemic, who this is affecting.
Right.
I lost my business because of COVID. I lost my mom because of COVID.
Right.
I lost my gym because of COVID. Like, what?
Right.
We have to put a face to it to really show that this is a real thing, because we're not showing the reality of it while we're saying wear a mask. If somebody doesn't know anybody who's caught it, they're like, meh, whatever. So they're not doing it. And so we have to put a face to this and really drive home how this is affecting our community, not just from a business standpoint, because unfortunately, I don't know that people are connecting that anymore, or I don't want to say they don't care. I don't want to go that far, but I just don't think that's hitting home anymore. I think it is, it really is having to put a face to it. And Courtney, I know you had some thoughts, sorry.
No, I was just going to say people have to see themselves in it. And if you think about the people that have basically been on their deathbeds and said, oh my gosh, I'm dying from this, and I took it as a hoax and a joke. Now let me try to save a life. But we've been finding that too. And actually, we have a number of research out there testing to see if what we actually have a partnership right now, Diana, with GWU to test, and it's a significant investment to test Missouri's public health approach to COVID on a number of different levels to see how it worked and what Missourians have to say about it. But yes, unless it's a story that resonates with them in that way that Stephanie described, I lost my mom was in a nursing home and experienced this. People are not, but it is also cultural, and it is separated by zip codes. Kara can tell you about her experience. She went to the rodeo. She was covering a story, in rural Missouri and what she saw. It is an issue that is rooted in race, and we need to talk about that and say that. If it were not that way, we would not have One for All Missouri, which is one communications effort going on for outstate and rural Missouri, and then Prepare STL so that we can talk in this way for certain populations and zip codes. But people don't really want to talk that deep about it, but that's what it is. It's race.
Yep, and I think so much that the pandemic has put a spotlight on that, so much more than it ever has before. Just the vast difference in those zip codes and how the communities are, their health, the way that they perceive health and the way they perceive physicians, vaccine, treatments, just the health in general, the difference. It's mind-boggling for that spotlight. I'm just so glad that it happened. I'm hoping that we can then now take it and move it forward so we can truly make a difference and break those barriers down. And that's something that I know Dr. Garza and I have talked at length about. That's really a focus for him.
Yeah, and the trust issue too. I'm sorry, Kara, but the issue that trust for certain populations and how that translates into effective messaging and communications, distrust, whether it's of government, whether it's of legislators, or whether it's of physicians. You have certain populations that are not trusting of the health system. So that all has to be considered when you're launching or rolling out an impactful campaign.
I just wanted to chime in and like confirm what Courtney said, and just I just wanted to just show a photo that really will make this real for people really quick, and sharing my screen. That's a picture of me at the rodeo in rural Missouri, where just me and another person, you know, we were the only one wearing a mask. That was some of the equipment that I took around with me. That's my daughter. But it just shows you, you know, how serious or how differently people are, you know, treating the pandemic when you have, you know, again, there were 15,000, I was surrounded by 15,000 people. Most of those people were maskless. Also went to a restaurant where 250 people were packed on either side. Lambert's restaurant, home of the Third Rose, which is very popular, but it just shows the difference in how people are really taking in the information.
And I think that proves such a challenge when we do say we have that barrier of how do we change the message. Well, the message has to be different for rural Missouri than it has to be for, you know, our underserved community than it does for our community that's wealthy. Like, we have so many different messages to get out there. How do we do that? And how do we change that messaging and make sure that everybody's hearing it and listening to it and that it means something to them? So that's been a challenge for us for a long time. And I think that's going to obviously continue to be a challenge.
Even the message, even in the zip codes and in areas, rural areas, there's different populations in there. There's different age groups in there, and developing a message so that all of those age groups understand it. The common message that we send out is wear a mask, but that's not going to influence behaviors. So I don't know how we get teenagers to wear a mask at a rodeo. I don't know how you do that. Maybe if the guy on the Bronco had a mask on, that might have been, or I don't know, call the horse.
Make them cool.
Or something. But those different populations in those different areas need to have different messages. And I think we all understand that. I don't know what the messages are. One way to find out is ask them. Ask them.
Right. That's why research is important. And I see that as one of the questions. How do you get, I think one of the questions is about target audiences, or how do you make sure that you're reaching the best way to listen to various target audiences so we can make sure communication speaks to the concerns toward change behavior. You got to talk to folks and not just the usuals. You got to really get into communities and spend some time and think about the different ways. I mean, when we're trying to reach certain zip codes, say in North City, we know that for Black populations, that face-to-face outreach is really important. So that's why Prepare STL, that's what that effort is focused on. It's focused on going up on people's porches and knocking on doors and really talking to people, not on mailing leaflets and that type of interaction. That works for a different group at a different time. But when we're trying to reach certain folks, we got to kind of get in there and get grassroots and not be afraid. And if you are, as the institution, then you have to build partnerships that are trusted messengers with organizations that can do that.
I just want to point out that there are various theories of persuasion. And one theory says that information leads to attitude change, leads to behavior. But there's another perspective that says sometimes you have to affect behavior, which will then lead to attitude change and might inform people. And it may very well be that we're going to reach a point in this country, if these numbers keep going up, that we're going to have more examples of requiring masks when you enter into places, and that over time people will then change their attitudes about mask wearing. I mean, I'm equally appalled as a human being that there are people who will not wear masks when they're around others. But we have to, there isn't just one theory of persuasion, and information doesn't always affect people's behavior, unfortunately.
Yes.
There were
Gary?
people who wouldn't wear a seatbelt though.
Yeah.
Yeah,
Right.
I mean, in the
We had
same
laws
way,
requiring
it was like, oh my God, what? You're trying to control me.
When we had laws requiring it, that it became more widely known, and we may very well reach that point if we're going to deal with this pandemic.
We've had a few questions here, and the panel has done an outstanding job of answering a couple of them here in your discussion. But one kind of strikes a chord that I think has kind of run through the conference, all of the conference panels today, and that is the competition that COVID and the coronavirus places on traditional and ongoing health messages that continue to be necessary. So if, I think, to paraphrase the question, if coronavirus and COVID continues for another year or 2 years, we would have a period of 24 months to 36 months of considerable competition to pretty much neutralize a lot of the efforts we have for other types of health issues, which they list: reproductive health, health insurance, pre-existing conditions, all of those things that you all have talked about working on. So how do you deal with the competition from COVID on that level, and is there a way to successfully mitigate the impact of COVID and the vaccine and all those issues at the same time while you're trying to be effective with these other issues? Is that possible?
I think you use COVID just as the hook to connect the issue. I think people are getting weary of hearing about COVID. I mean, how many more news stories can we put out there about COVID? And if you can use COVID as a hook to your issue, whether it's why it matters to get regular screening on something, and some of the challenges of that during COVID, I'd use it as a hook.
Yeah.
And I would say we need to think about messaging around COVID to what end? Is it filtering up to something bigger? Like I said, like the need for a stronger public health system, and something long-term and sustainable? Is it filtering up to some policy change? So how can we transition, communications and use it as kind of a nudge to other things that will help benefit folks in health across the board for years and years to come? I think if we're starting to see that we're experiencing messaging fatigue around an issue, let's take a step back and reflect, like I said, to what end? What policy changes does this need to lead to? What bigger picture are we trying to focus on, and how we can transform that energy and those resources into doing that for the long run? I think some people have some lanes and some spaces they need to be in the direct services and those strategies for COVID. But then there's another aspect of this, that long-term sustainable systemic lane that we also need to think about, and the role that communications is going to play in the evolution of that.
I would add also that I think that's on, and I'll take ownership of this as a communications person at a healthcare system, it's on messaging those things like get your mammogram and why it's important to do these things and you don't delay care. It's on me as a communications professional from a healthcare system to have the relationships with reporters and to be able to present a desirable story, not just, hey, do a story about mammograms. Like, that's not appealing to a reporter. And Carrie, you can maybe jump in. I think important for us to recognize as a profession that we have to find those stories in there to really get this across to people, whether it's COVID or not COVID. Anytime we have to be responsible for finding the story in there to be able to relay the message at the end. It's not just about the message, it's about how you relay it. And that's on us. And as a profession, I think we lack there sometimes, and it's not okay. And it's something that we need to focus on. I think everybody's in a hurry, but that's on us to make sure the reporters get something that's a desirable piece that can tell that story.
And you know
Yes,
what,
yes, and
Stephanie?
yes.
I'm sorry, Kara, you're in this conversation. Go ahead.
No, I just say yes, yes to everything Stephanie just said. Stephanie, call me after this. Let's talk. Let's talk about some story ideas, because I think that that's so
I'm
important.
in.
It's so competitive though, so you have to think about what the journalist is up against, and it's information overload, and we're all competing, and trying to get the stories out. I mean, I can't tell you how many times I've pitched something and it's like, no, somebody already did that, and they did it last week, or they just did it a minute after. It's like, so it's so competitive, especially when you talk about wanting to tell stories on a national level, right? But there are some wonderful stories in this area that need to be told nationally, but it makes it even more competitive. So yeah.
I was also going to say the flip side of that, though, to Stephanie's point about where we're lacking, and it's our role to pitch certain level of stories, but it's also our role as communicators, Stephanie, when a reporter sends us an email or we get an inquiry from a reporter, that we push back on what the reporter is asking. Because I can't tell you as the communicator who's getting, hey, can I talk to somebody about this? How many times in my day-to-day that I respond with, well, what about that do you want to know? Because you can go on the internet and Google that and find out all the information you know about that. So why not thinking about it like this and the underlying issue of this? And have you thought about it this way? Because if you have, then yeah, I have an expert who can speak to it that way. And I think that is our job as leaders in the communications field, to kind of push back a little bit on, and I'm not saying this in a bad way, on the lack of exploration that's taking place in the journalistic profession before they come to us. I'm not just a talking point or just a source in your piece just to say you talk to somebody at MFH. I want to get some value out of telling my story in this context too. So how can this be mutually beneficial, and how can we really build a partnership on that? I do think that we don't do that well as either.
No, I think it's a partnership. It's give and take, and that is our job. I completely agree with you. It's how can we, if the story is maybe kind of, I would say half baked, but how do we help advance that to help them tell a better story? Because we know that better than, that's our industry. This is what we know, and so that's on us. Yep, I completely agree with you.
So are there other questions from the attendees out there that they'd like to offer? We've got a few minutes left here. And if you do, please put them in the Q&A right now. One question was about, and it goes back kind of to the first panel, but I think you all can offer a different point of view as well. The role of communications in the profession of public health communications. And then we talked about that in the clinical setting earlier, but now what about in the role of communications in the advocacy point of view and in public education? I know we've talked about responding to reporters, and we've talked about being reactive, but in a proactive way. Is that being included in your overall plans? And to what extent is communications considered a valuable tool that you can use?
So I'll say, I think in the evolution of any health issue, social justice issue, you can't have the greatest impact without thinking about your communication strategy. So it's absolutely critical, and it's not surface level. It has to be strategic. I don't think you can just come up with tactics just, one off. You really need to think it through. Why is there a need for us to communicate? What are opportunities and challenges for us communicating this way? And what are different messages to reach various audiences, and being able to flesh that out initially. I think in the philanthropic communications world, we like to think of it as comms for good, because we take on issues that in so many ways are not good issues. We're communicating about gun violence prevention, firearm suicide prevention. We're communicating about, young people in Missouri being obese. And we're communicating about the overwhelming number of Black babies dying in North St. Louis and in the Boot Heel. And all of those really kind of catastrophic health things that are happening right before us that people are just not in tune with. So definitely, in order for you to get your issue out there and sustain it, even if it takes time to get community buy-in, communications plays a role in that. And you win when you think about communications in that way. When you don't, you lose.
Anyone else have a thought?
Oh, I do. Courtney just said something that made me think. I lived in St. Louis for 4 years. And I had 2 mentors who were leading efforts to try to improve maternal child outcomes in St. Louis. And your comment just now, with all the efforts that have gone on, it just makes me feel not very hopeful. How hopeful can I be? How much a difference the communications are going to make? What is going to make a difference what will make a difference in those outcomes? How are we going to improve maternal child outcomes after how many years in St. Louis? And
So it's
if we're
happening.
not communicating, or we're not communicating to the right people, or we don't have the right messages. I really thank you for bringing that up.
Mm-hmm. And it's actually happening, Diana. With that issue, it's a very slow process. And the reason why it's so slow, because we had to spend a number of years doing collective impact, getting the community involved, getting them on board, finding the right partners to help us carry the work forward. And then transitioning that work to community so that they have programmatic and fiduciary responsibility now after 10 years for that, that work. So initially, communications was, how are we telling the stories that, hey, babies are dying, and we had a number of strategies going on with that. There were some partnerships with KBIA and a number of stories that were being pitched. I don't know if you all remember, Nancy Cambria was a reporter at the St. Louis American that was really committed to family health and that issue. And then she moved on to work with Jason Purnell. I think it's now at U City, but she used to cover that for the St. Louis Post-Dispatch. But we had to do a lot of community engagement work and bringing community along. And that's where that commitment, so that was one way, but that's where that commitment, that core value of commitment comes in for us at MFH, knowing that it's not going to be maybe a 24-month turnaround or an 18-month turnaround. And we have to be ready to stick in and dig in for the long haul. It may take years to see those numbers go down. And now they're starting to go down. And now, we can infuse other areas of our infant mortality work with maternal mortality and women's health, and come out with a stronger voice, because we've been invested in that work on the communication side and programmatic side for a while.
So
If I
thanks
could
to
just
the
offer.
Thanks
I
to
was
the
gonna-
attendees for your questions. And now I believe Dean Rothenbuehler would like to summarize and talk about the afternoon session.
I would, that's true. But I think Jana has one more comment.
I'm sorry.
This is in the Glimmer of Hope category. For a recent project that I was working on in my center, I went through all of the major public health efforts that CDC has been involved in the past 74 years. The mean length of time to achieve behavior change and public buy-in is 40 years. So if you're 20 years in, you're halfway there, keep going.
That's
Thank
great.
you for that bright summary.
Yeah, that the glimmer of hope indeed. But look, this stuff is complicated. In both panels, we had examples of level issues, level complications. Here, we're communicating sometimes to individuals when what we need is community change. And we can't achieve community change without individual change, but the individuals won't change till the community changes. In the first panel, the same kind of level complexity and level tension arose in healthcare institutions, in a hospital, for example, of the face-to-face, individual to individual work in the care delivery, and the organizational structure and policy. It's all aimed at the same thing, but the levels operate differently by different logic and require different analyses. It's been a very rich afternoon. I've taken a bunch of notes, and I'm looking forward to continued conversations with our panelists tomorrow morning. But I want to end the afternoon. I'm not going to try to summarize, but I do want to give every panelist a chance to nominate one key idea, one takeaway, one thought that you would like all of us to still be thinking about tomorrow and maybe even next week. And for convenience, I'll just go back through in the order that everyone spoke earlier this afternoon. So Diana, you're up first.
I'm going to pass because I'm sort of spent. This last discussion was really rich, and I've got a lot of stuff swirling in my head, so I'm going to pass. Thank you.
Okay, Jenna.
Well, thank you for the second panel. 3 dynamic young women and an ominous blonde was a marvelous way to end the afternoon. If I were to choose one thing, I believe it would be looking at how we incorporate communication skills into the training of health and public health professionals. Because if everyone has the opportunity of being a communicator or of being someone who says, well, I just work there and they never tell me anything. And I always want to have my people being communicators.
Yeah, that's great. Excellent. Bob?
I look at all of the information that we've covered in the last 3+ hours and all of the committed efforts. I mean, when you look at the people on the screen, everybody's bringing so much to public health and to healthcare and to education and journalism. So when I think about all of those combined efforts, and it's exponentially more throughout our country, I think the thing I want to say is just don't give up. Like sometimes it seems like we're fighting the battle, the Sisyphus life of pushing that rock, but just don't give up, because as Jana can tell you, even a 40-year journey, you'll get there 40 years from now. So hang in there.
All right. Thank you, Bob. Stephanie.
I think there's so many things to take away. The one thing that really struck with me as I'm sitting here struggling on how to better communicate was, and I don't remember who said it, but reaching out to our religious leaders and getting them involved in the conversation. I think that's a great avenue that personally we haven't gone after. So that resonated with me from a personal standpoint.
Good. Thank you. Kara?
For me, it's just, I guess, just continue to put people first, real people first, right on the ground, whether that be, nurses, people who are receiving care. That's just so important to me. And I hope that you hear that from my heart, and that more of that can continue to happen all around, because it's so important. People want to share their stories. They have stories to tell. We can't tell them all, but I'm certainly here to do that storytelling and do it to the best of my ability. So many journalists want to do a good and thorough job. And so, no, it's a great discussion. Thank you.
Thank you. Courtney?
I would say that surface level communications, they're dead, and that we need to start really investing in means and resources that really meet audiences where they are, that empower communities, and have their viewpoints front and center. if you are not focused on strategic communications efforts, just those activities and tactics of placing ads and blanket messaging, it's not adding, it's adding to the, I'll take I'm gonna go back to Stephanie's word, to the white noise.
Okay, thank you. And Ellen?
I was really struck by the conversation of cross-training for healthcare professionals, that doctors and nurses and pharmacists and PT people could be training together. In another life, believe it or not, I was a provost in the University of California system, and I established a medical school at Riverside. And so I spent 2 years talking to doctors who never wanted to talk about nurses, never wanted to talk about other healthcare professionals, but neither did the community that we were dealing with. They only wanted a medical school. They didn't care about the other healthcare professionals. And I realize now that was a real disservice in the way that we put that particular medical school together. So I think that's a really important issue. That medical school, by the way, is still going. I'm very proud to say it was established after I left, but I did put the proposal together. So I think that's a really important point, that everything needs to be interdisciplinary today.
Yeah, that's great. That's so true. And this whole effort has been interdisciplinary. So I thank all of our members of the audience. I hope that it's been as rich and productive and stimulating for you as it has been for us. And I would put in just one little plug for the School of Communications. We have gathered these folks today as part of a kickoff conversation for potential development of curriculum. And we want to do something that's unique here in the school, that is valuable to the community, that serves a public good, that provides talent for an industry that needs it, and that provides opportunities for professional advancement and success for our students. And we are looking forward to continuing that conversation and really digging into the idea of what we as educators can do to make our contribution to these health needs, public information needs, and health communication in general.
Eric, I have one closing comment, if that's okay.
Yes.
As we are all communicators when we step outside our door. And so I'm encouraging all of us to wear our masks, wash our hands, get all of our family members to do it, get our neighbors, get our community. And if all of us reach out today and just do 10 people, that's 90 more people that would be complying with what we think is important to do.
Yep.
Thank you, Dan. Thank you.
Sir.
All right. Thank you, everyone. It's been a fantastic afternoon. Thank you and have a good evening.